This video will present acute renal failure, intended as a review for NCLEX examination. Acute renal failure is the rapid loss of kidney function from renal cell damage. It occurs abruptly and can be reversible. Based on the amount of urine that is exerted over a 24-hour period, patients with acute renal failure are separated into two groups: oliguric and non-oliguric. Oliguric are patients who excrete less than 500 milliliters per day, while non-oliguric are patients who excrete more than 500 milliliters per day. In non-oliguric patients, the urine is of poor quality. It contains little waste because the blood is not well filtered, despite the fact that an adequate volume of urine is excreted. It is present in 1 to 5% of patients at hospital admission and affects up to 20% of patients in intensive care units. Signs and symptoms are caused by: first, retention of waste; second, retention of fluids; and third, inability of kidneys to regulate electrolytes. Acute renal failure leads to cell hypoperfusion, cell death, and decomposition of renal function. There are three causes of acute renal failure. First, pre-renal; second, intrarenal; and third, post-renal. Pre-renal ARF is characterized by inadequate blood circulation, perfusion to the kidneys. It includes outside the kidney, caused by intravascular volume depletion, dehydration, decreased cardiac output, decreased peripheral vascular resistance, decreased renovascular blood flow, and perirenal infection or obstruction. Intrarenal ARF involves within the parenchyma of the kidney. It is caused by tubular necrosis, prolonged ischemia, intrarenal infection, and nephrotoxicity. Finally, post-renal ARF is caused by a sudden blockage that prevents urine from flowing out of the kidneys. It exists between the kidney and urethral meatus. Causes include such as bladder neck obstruction, bladder cancer, calculi, and post-renal infection. Acute renal failure often does not cause symptoms that you notice. If you are already in the hospital, tests done for other problems may also detect your kidney failure. The complications of acute renal failure can affect the entire body, including the digestive system, heart, lungs, and nervous system. Infection is one of the most common complications of acute renal failure because the body's immune system may stop working properly. They may suffer from viral hepatitis. Decreased perfusion can cause acute organ failure, such as cardiac or liver failure. Proceed with the discussion of the different phases in acute renal failure. Let's start with onset phase. Onset phase begins with precipitating event. The second phase is the oliguric phase. It involves the following: duration of 8 to 15 days. The longer the duration, the less chance of recovery. Sudden decrease in urine output. Urine output is less than 400 milliliters per day. Signs of excess fluid volume, hypertension, edema, and congestive heart failure. Signs of uremia, anorexia, nausea, and vomiting. Signs of metabolic acidosis, Kismawal respirations, signs of neurological changes, tingling of extremities, drowsiness progressing to disorientation and comatose, signs of pericarditis, friction rub, chest pain, and lower grade fever. Laboratory analysis. Restrict fluid intake. If hypertension is present, daily fluid allowances may be 400 ml to 1000 ml plus the measured urinary output. Administer medication as prescribed, such as diuretics. Now let's proceed with the diuretic phase. Urine output rises slowly, followed by a diuresis of 4 liters to 5 liters per day. Excessive urine output indicates that damaged nephrons are recovering their ability to excrete waste but not to concentrate urine. Dehydration, hypovolemia, hypotension can occur. Level of consciousness improves. Administer intravenous or IV fluids as prescribed, which may contain electrolytes to replace losses. Recovery phase. Recovery is a slow process. Complete recovery may take 1 to 2 years. Urine volume returns to normal. Memory is improving. Strength increases. The older adult is less likely than a younger adult to regain full kidney function. Acute renal failure can progress to chronic renal failure. The assessment part involves assessing objective and subjective data noted in the ARF phases. Here are other interventions for acute renal failure that should be executed. Monitor vital signs, especially for signs of hypertension and irregular heart rate. Monitor urine and intake and output hourly and urine color and characteristics. Monitor daily weight, noting that an increase of 0.5 to 1 pound per day indicates fluid retention. Monitor for acidosis. This may be treated with sodium bicarbonate. Urinalysis for protein level, hematuria, and specific gravity. Monitor for altered level of consciousness caused by uremia. Monitor for signs of infection because the client may not exhibit an elevated temperature or an increase in white blood cell count. Monitor the lungs for wheezes and rhonchi, and monitor for edema, which can indicate fluid overload. Administer a prescribed diet, which is usually moderate protein to decrease the workload on the kidneys, and high carbohydrate diet. Restrict potassium and sodium intake as prescribed based on the electrolyte level. And finally, be alert to nephrotoxic medications. Studies say that about half of people who develop acute renal failure recover. Of those who recover, many have normal kidney function and do not need further treatment. But a few do not regain kidney function and need long-term dialysis or even a kidney transplant. Acute renal failure is often progressive. After it has developed, you have a greater risk to developing serious problems with infection and heart disease. Always remember, nephrologists will be able to answer questions about your choices when cure is no longer an option. Thank you very much for spending time viewing this video. I hope you learned something new about acute renal failure. Have a great day.